Welcome everyone to sqadia.com. My name is Osama, and today we are talking about hemodynamic dysfunction. And in this part of the lecture, we're going to talk about embolism. What is embolism? What are the different types of emboli? And what are the miscellaneous sources of emboli? So let's start off with embolism. So what is embolism? As we discussed in the previous lecture, this is actually the passage and eventual trapping of any object within the vasculature. So it is different from the thrombus. Thrombus actually stays at its site. It does not move along with the circulation and it is adhered to the endothelium. But embolism is actually a mobile part, and maybe according to some sources it may be more dangerous as well. Now, thromboembolism. What is thromboembolism? So embolism of fragments of thrombi. So thrombus, when it detaches or when it breaks and it dislodges and it starts moving around into the circulation and becomes an emboli, so that is known as thromboembolism. So it is an emboli for which the source was a thrombus. So that is thromboembolism for you. And these are the most frequent types of emboli. And these thromboembolism can be actually formed as pulmonary emboli, arterial emboli, or paradoxical emboli. And as you can see in this picture here, so there is this emboli. So what happens is that this emboli travels along with the blood circulation, and as, for example, if we talk about arteries and they decrease in lumen size, they become arterioles and capillaries. So these thrombi can actually go into those smaller blood vessels and cause occlusion in them. So that's why they are dangerous. And the other types of emboli includes fat emboli, air emboli, amniotic fluid emboli, and miscellaneous sources of emboli. So we are going to start off with the thromboembolism, which is the most common. So what is thromboembolism? We already discussed. So it is the most important cause of most important type of emboli, and it is a very important cause of sudden death. Why? Because these emboli can actually go and, for example, occlude a coronary artery, resulting in heart attack or myocardial infarction. Similarly, it can go to the brain, and, for example, it can occlude a cerebral artery and result in the death of the brain and thus death of the person. So that's why they can be a cause of sudden death. They're usually occurring in immobilized post-operative patients and congestive heart failure. So it is very important whenever a person is having surgery, so they should follow it by physical therapy even when they are on the bed, which is also known as bedside physical therapy, so that they do not develop these thrombi and then they do not get dislodged. But once those thrombi have formed, or there is presence of deep venous thrombosis, DVT, then they should not be mobilized. Otherwise, that movement, the physical therapy or those movement of the lower extremities can actually lead to the dislodgement of those thrombi and thus formation of the emboli, which can result in myocardial infarction or stroke or any condition which can be lethal for the patient. So immobilization, as I already said, leads to venous thrombosis in the lower extremities, as I gave you an example of deep venous thrombosis. So friable thrombus, weak thrombus, actually breaks away and travel through the venous circulation and lodge in branches of the pulmonary artery, and it can cause pulmonary emboli. And they vary in size from a saddle emboli, which is actually obstructing the bifurcation of pulmonary artery, resulting in sudden death, or they can be intermediate sized emboli, which results in pulmonary hypertension and acute right ventricular failure, to even small emboli, which may be clinically less segment, but still all of these emboli can be dangerous for a person. And obstruction of pulmonary artery can also lead to hemorrhagic pulmonary infarction, and that is also very dangerous. So this is a picture where you can see that there's an emboli which has dislodged from any side and it moves here. So it goes into the from the systemic circulation to the pulmonary circulation. For example, it dislodged from the veins like DVT, and it came here and it came to the heart, and via the heart it moved into the lungs. Now that emboli, when it reaches a suitable place, when the lumen is small, it goes there and it occludes that part of the circulation, which results in the ischemia and infarction and necrosis of that area, and that results in pulmonary embolism, and it can be a cause of death as well, as you can see here as well. So the second was the arterial emboli. They arise from mural thrombus. What are mural thrombi? They actually adhere to wall of heart chamber or major artery. So pulmonary emboli were actually resulting from venous thrombi such as DVT because of immobilization, but these actually are arising from the arterial circulation. So in left atrium associated with mitral stenosis and atrial fibrillation, and in left ventricle, they can be caused by myocardial infarction. And at junction of internal and external carotid arteries, they can be a cause of thrombotic brain infarcts or even emboli. So what is the difference between a thrombotic brain infarct or emboli? Thrombotic brain infarcts actually impairs the circulation by occluding the external or internal carotid arteries, which give to the branches, which gives off branches which actually supply the brain. So that can actually lead to that can actually lead to the brain infarcts. But in emboli, actually the emboli dislodges and it goes, and it may involve the artery which is supplying the brain, like a middle cerebral artery, and occlude that. So site of arrest for a thromboembolism includes branches of the carotid artery, most commonly middle cerebral artery, which is the most common artery involved in cerebral infarctions, also known as strokes. And the second one is the branches of the mesenteric artery. So hemorrhagic infarction of the intestine would occur because of this. And then once again, branches of the renal artery, which would result in a wedge-shaped pale infarct of renal cortex and damage to the kidneys. So here you can see the thromboembolism or arterial thrombolysis. So there is actually a dislodged emboli, which is actually occluding this artery, and so no blood supply here, so the affected area may get cold. So you should understand the difference between the pulmonary emboli and the arterial emboli, because pulmonary emboli, the origin was from the veins, and the arterial emboli, obviously it's a problem in the arteries. So once again, thromboembolism or paradoxical emboli. It is left-sided emboli originating from venous circulation but gain access to arterial circulation through right to left shunt. How does that occur? There are two common conditions, which are the patent foramen ovale and atrial septal defect. In both of these conditions, there is actually a communication between the right and left side of the heart, and their mixing of the blood can occur, and that can actually result in paradoxical emboli. Then talking about the other types of emboli, which are not thromboemboli, but they are emboli. So one of them is the fat emboli. So as the name suggests, it has an involvement of the adipose tissue, which actually comes from the bone marrow. So particles of the bone marrow or other intraosseous fatty tissues resulting from severe or multiple fractures. So a fracture can actually result in the formation of emboli as well, which can lodge and occlude the arteries or veins or the circulation in the lungs, brains, kidneys, or other organs. Another one is the air emboli. So it is the introduction of air into the circulation, and it is usually because the consequence of penetrating chest injury like a stab wound, and can occur as a decompression sickness, as occurs in deep sea divers on rapid returning to the surface. And the bubbles of relatively insoluble nitrogen come out of the solution and obstruct circulation, causing pain in the musculoskeletal system, like for example in the muscles or bones, and small infarcts in the central nervous system as well as bones and other small tissues. And nitrogen has the affinity for adipose tissues, so people who are obese or who are fat are actually at a greater risk for developing this decompression sickness. Another type of emboli is actually the amniotic fluid emboli, which actually occurs in mothers during the pregnancy part. And what happens is that there is an escape of the amniotic fluid into the maternal circulation, which actually starts an inflammatory and coagulatory process. And when that coagulation process is initiated, it leads to the maternal death because of the impairment of the circulation. The miscellaneous sources of emboli actually include the fragments of the atherosclerotic plaques, in which actually there's our deposition of the fat, and they actually dislodge and they go and occlude some other part of the vessel. And similarly, clumps of infected tissue can also serve as an emboli, and tumor fragments as well. So in this lecture, we talked about the embolism, the sources of embolism, the types of emboli, including the thromboemboli and the other types, and also the miscellaneous sources of emboli. So I hope that you learned something new out of it, and that please do watch the other part, which is the last part of this lecture as well. And keep on watching sqadia.com. Thank you very much.